All right, everyone. It is 11:30. It looks like people are starting to trickle in here. So I'll just get started with our little preamble because we have a pretty packed meeting today. Uh, if you haven't already, please share your name, position, organization, and location in the chat so that we can make some connections and everyone can see what organization you work for and where you're located. Okay. So welcome everyone to our September virtual info session on keeping people insured. As you may or may not know, if you've been here before, my name is Landon Solano. I'm a communications specialist for Forward Service Corporation. I host and do the newsletter, host these sessions and do the newsletter. And so if you have any thoughts, feedback, suggestions for future topics, you can always reach out to me directly, or we will have a 2-minute survey that will allow you to give your feedback and suggestions after the event, which are always helpful and we always read them. So stay tuned for that. Just to let you know, upcoming, we have 2 more sessions left this year. Next month will be on housing resources, both for homeowners and for renters. We are solidifying a speaker for that right now, but we are excited for what that can bring us. And then in November, we're aiming to address internet and other utility access issues throughout the state of Wisconsin, particularly in rural areas. So hopefully you can join us for both of those. Just a reminder that you'll receive a recording of today's session in case you can't stay for the whole time. Also, for future reference, if you RSVP to these sessions in our newsletters, you'll also be on the list to receive the recording of it after the fact. So if you know you're not going to be able to attend, but you still want to be able to see it, go ahead and RSVP and you'll still get a copy of it. You'll also get a PDF of today's slide deck, as well as a list of all of our FSC offices throughout Wisconsin in case you want to connect with one of our program coordinators or programs. So today's topic, we're going to be talking about keeping people insured. We have someone from Covering Wisconsin with us who I'll introduce in a moment, but just to give you an idea of what we'll be covering today, we'll go over what Covering Wisconsin services are, what Medicaid members need to know regarding these changes that are happening, transitioning to other forms of coverage, as well as some other tools and referral options for you. If you have any questions, we will periodically bring up opportunities to ask them throughout, but put them in the chat. I'll be monitoring that while our speaker is presenting today. And then there will be a little bit of time at the end for other additional questions and answers. So today's topic, keeping people insured. I felt like we should keep this to one very small but potent statistic here, which is that DHS estimates that roughly 1.6 million people in Wisconsin, that's a large number, will need to go through the renewal process over the next year. That's about 1 in 4 people. So the results of that, the consequences of that, are something I have a hard time wrapping my head around. So I'm very excited today to have a speaker from Covering Wisconsin with us, Miss Caroline Gomez-Tom, Enrollment Network and Accessibility Manager for Covering Wisconsin. I see that you're listed as me, but everyone don't be confused. It's Caroline talking here. Caroline, feel free to share your screen with your slides. I'm very excited to have you with us on such short notice as well. There's a bit of a scheduling shift this morning. So thank you so much for taking the time to be with us on such short notice.
Wonderful. Thanks for having me, Landon. And I know that you, I think, is it okay if I stop sharing your screen to share
absolutely.
mine?
Yep, go for it.
I am happy to talk with you all today, especially because of how important the issue of access to healthcare is, and health insurance is a door or a window to accessing your healthcare. And that's why Covering Wisconsin is here and available across the state of Wisconsin to help folks make those connections so that they have all the information about the options available to them. So glad to be here with you guys. So I will be doing kind of a Covering Wisconsin overview. I'll also talk about kind of the moment that we're in right now with the Medicaid unwinding. Are you able to see my slides? Okay, fantastic. You already learned a little bit about who I am. I've been with Covering Wisconsin now for nearly, I think it's nearly 11 years. And I left for 2.5 to work at 16th Street Community Health Centers, and then came back because I loved it so much. So it shows how good of an organization and a mission, and really just the team that is a part of Covering Wisconsin is for me to have wanted to come back, and now have been back for, I think, another 2 years. So time flies when you're having fun. And we'll be going over the review of Covering Wisconsin services. We'll be talking about what Medicaid members need to know, because right now we're going through this transitional moment that we'll talk about in a few slides. And then we'll talk about transitioning to other forms of coverage, and then what resources and tools are out there for you all to use. And if there are questions along the way, I'm happy to take them in the chat, or if people want to raise their hands. So know that this can be interactive. How much time did you have allocated for this, Landon?
I mean, we can do about 35, 40 minutes, leaving some room for questions at the end, unless people can put them in the chat during, but
Perfect.
I'll be taking some notes and ask some questions as well.
Excellent. Okay. All right. So Covering Wisconsin, we're actually a program out of the University of Wisconsin-Madison UW Extension. And what that means is we started off as a project. Actually, it was like a grant under the Robert Wood Johnson Foundation. And the person who led that initiative in Wisconsin was a professor at UW-Madison. And that project essentially became what is now Covering Wisconsin, focused on health outreach, education, and enrollment, and connecting our partners so that we are able to share this information widely in our communities and make sure people don't fall through the cracks and can access the options that are available to them when it comes with health insurance. And there's a couple of ways that we do that. And in terms of helping people find and use their health coverage. One is through our Health Insurance Navigator program. So we are federally certified as well as state licensed to help people sign up for health coverage. This is a project that came out of the Patient Protection and Affordable Care Act, where the federal government, through the Centers for Medicare and Medicaid Services, provide funding to states in order to help people get connected to coverage. And this resource is meant to be unbiased, impartial, and free. And Covering Wisconsin has held that funding, that grant, that program since 2014. So we've been doing this for quite some time. And we've grown from serving initially only 11 counties in Wisconsin to now serving statewide, all 72. And then another piece of our work that has been really since the get-go, when we formed Covering Wisconsin back in 2003, I almost said 13, but no, we've been here for 20 years now, was education, outreach, and promotion. We've been building resources and materials and taking complex information and making it accessible to our communities. And we've done that through consumer testing of our resources, as well as providing trainings and receiving feedback from professionals and partners just like you. And so just to go over a little bit more in depth about our navigators. What navigators do is they help folks understand health insurance questions, big or small, help people access plans and financial help, can help folks sign up through healthcare.gov, BadgerCare Plus, and the state's Medicaid program, and then help with billing issues. So like when people have questions about using their health insurance, they can come to one of our navigators. And then, of course, there's folks that still may be ineligible for certain types of health insurance. For example, if someone is undocumented, and currently people who have the deferred action or of childhood arrival status, immigration status, they may not qualify for these traditional Medicaid or health insurance marketplace plans, but we can help them access community health programs like federally qualified health centers and free and charitable clinics. And our Navigator program, as I mentioned, covers all 72 counties, and we have 45 navigators. We started, I think, with just about 4 or 5 initially and grew to now having 45 people who can help across the state. And some of the organizations listed to the left are partners that we subcontract with in order to reach every corner of our state. We provide service in person, over the phone, or through Zoom appointments, whichever is the preference of the person that needs assistance. And they can look at our appointments on our website, which I'll share with you on a later slide. And you'll hear me kind of use a couple words interchangeably. Navigators is what we are at Covering Wisconsin, so federally designated to provide this service. We're also licensed and certified both by the state and the federal government. But I will also use the word enrollment assister, which is kind of an umbrella term for anyone who's providing some enrollment assistance. And so that also includes our certified application counselor partners that we partner closely with, who are also certified by the federal government and the state, but they don't have that federal designation to be a navigator entity, and they're usually serving a smaller population, usually their patients. So for example, many health systems, community health centers, free clinics, and some community-based organizations will house their own certified application counselors. And then we also partner closely with agents and brokers who we define under the big umbrella term of enrollment assister. And these are folks that help folks usually with the health insurance marketplace, but primarily Medicare. So folks who are 65 and older or who have had a disability for over 24 months, they qualify for Medicare, and agents and brokers are able to help them kind of determine their options. And they typically get paid by commission. And so we partner with the folks that are willing to help anybody, regardless of income, and regardless of if some of the family members may be eligible for Medicaid. And we actually have them go through Medicaid training in order to be considered in our appointment resource, which is our Get Covered Connector tool on our website, where people can book appointments. But one big thing I want to emphasize, and I'll probably say it a couple times, is that health insurance help should be free. It's a big red flag if someone tries to charge for assistance in accessing health insurance. That's not that health insurance itself will be free, but the process of getting the insurance should be free. And we emphasize this because we know that there are bad actors and scams out there, especially when there is a moment like this where there's a big transition in policy. There's a lot of people that will then unfortunately take advantage of folks because there's a lot of information out there and it can be very confusing. So we try to lead up with, it should be free. Getting help should be free.
Can I ask a quick question before we proceed?
Of course. Yeah.
And you might get to this later in your presentation, but as far as people reaching out, do you have physical locations, or is it entirely through phone and internet and the Access app?
That's great. So we do meet people in person, and we do have some physical locations because some of our partners are community health centers, or they're located in a public facing organization. I myself am actually located in our Milwaukee office, which is a leased space with community advocates.
Mhm.
And then I know we have, if we're not based out of a physical location, we have opportunities for people to meet us in public locations like libraries,
Cool.
economic support centers, work centers, job centers, things like that.
Fantastic. Cool.
Yep. All right. So now we're going to transition to kind of this moment that we're in and what Medicaid members need to know right now, because this is kind of the big hurdle that we're up against this year. So you're going to hear me talk about the unwinding, and it sounds very looming because it kind of is. This is the moment that we're in and the process of moving people who enrolled in Medicaid at some point during the pandemic. And there were federal policies that allowed individuals to maintain their benefits over the past 3.5 years without having to renew their coverage. The policy typically is that everyone who has Medicaid has to renew every 12 months. But because of the pandemic, they extended this requirement so that renewals were paused and that people could maintain their coverage even if they had a change in income or household size or what have you. And so the unwinding is this transition where we're going back to the previous rules before the pandemic that required people to complete routine renewals and update their income and household information for eligibility purposes. And this is a statewide collaboration between the Department of Health Services covering Wisconsin and all of our various partners who provide enrollment assistance to make sure that we can implement a successful return to routine operations, particularly the annual renewals, and then help people stay covered, whether that means they complete their renewal and they stay eligible for Medicaid, or they find out they're no longer eligible and they need to transition to some other form of coverage, like employer coverage or coverage through the health insurance marketplace, healthcare.gov. And so I mentioned it's an unwinding, it's because it's not happening all at once. We currently have, well, as of May, we had 1.6 million people in Wisconsin enrolled in the Medicaid program. And to imagine having all of those people renew all at once, I think the system would collapse. So the way that the federal government required states to implement this was to do it over time. And so that means every month, a different group of people will need to renew. And they tried to kind of streamline it so that everyone in a household would have to renew at the same time. And if they also are receiving food share, which is the food assistance benefit, that they would kind of coordinate those renewal dates so that there was not a whole lot of, oh, I have to renew for this program this time and this program another time. But of course, no system is perfect and all intentions are good, but the results might not be. So it's also just as important for us to be working together to make sure that we are out in the community talking to people, making sure that they are connected to the resources that are available to help them. Because one thing that has yet to change is health insurance is complicated, and that includes the state's Medicaid program. And thankfully, there are people available like navigators, like enrollment assisters that can help through the process. So the big emphasis during this time has been to help people update their contact information and get connected to their access.wi.gov account, or at least download the My Access app, which is a resource to help kind of maintain their benefits or check their status of their benefits. And then of course, know when their renewal date is going to be between essentially a couple months ago to June of 2024. And we have been concerned of folks renewing too early because if they don't need to renew until a later month, they could lose their coverage unnecessarily. And then we're also concerned of folks not renewing in time because there could be a potential lapse in coverage, even if they are found eligible at a later date. And so it's really important for people to know when their renewal month is. And so that's why many of our organizations and partners have been out in the community talking to people. And when you find out someone is eligible for Medicaid, you're helping them download that app and find out when their renewal month will be. And so we have the QR code here so that you can kind of know the next steps, so that if you have someone who is Medicaid eligible in your life, or you yourself are Medicaid eligible, or you're just out in the community and someone mentions it, you know what to do, and you can help them with some next steps, including downloading the My Access app, finding out when their renewal month is, signing up for push notifications because it will remind them it's time to renew in that month. And then when it is their renewal month, we've been recommending that people renew between the 1st and 15th of that renewal month in order to avoid any issues with gaps in coverage, because there is other requirements. It's not just filling out the renewal application, but there's verification that might need to be submitted. And we just want to make sure that that's done way in advance of the end of the month. And then these are just some examples of what the Access renewal website looks like. So if people are doing it over the or online, access.wi.gov, which is required, you can't do it on the app, unfortunately. It'll remind you when you need to do it, but you do have to go to the website to make to do the renewal, or you have to call your local Medicaid office. But this is probably the fastest way to do it, is to go through access.wi.gov. And then you'll also see the information of where to find your renewal date or your take action date, so that you can avoid losing coverage. And this is kind of the screenshots that are available to show you that. And then the My Access app, it's not just to find out your renewal date. This is another resource for people who have Medicaid benefits. It allows them to upload documents on their phone, which is really convenient because you have a camera on your phone, most likely. And you also get those notifications to act. And my favorite part, which is actually not listed here, is that you have a digital insurance card on your app. And a lot of times people will lose their Forward Health card. And rather than having to go through the whole process of trying to get it restored or sent back to you, you have a digital version right in your app. So yes, and so this is just to emphasize, when you're enrolling or signing up on your My Access app, you want to sync it to your actual account. And to do so, you'll need either your Medicaid case number, your Forward Health ID card number, or your Quest card number. The Quest card is for food share. And then this is going through the app where you can find the act by date or the renewal month date. And once you're in the app, it's fairly easy to use. Another resource that is available from the state is they have a website dedicated to Medicaid members where people can go and select their renewal month. So you do have to know when your renewal month will be, but then you can sign up for email notification so that the state will email you saying, hey, it's time to renew. And they have the exact date for the current month's renewal deadline, to make sure that there are no gaps in coverage. So for September, the deadline is September 15th for anyone who needs to renew by the end of this month. And this is where it's just showing where you can sign up for those resources and how it shows what people in each month need to do at that time. So if you know your date is in October, You can sign up for those renewal reminders. If you're in September, you should be renewing now. August, it's, last chance. Well, last chance is passed, but you still could complete your renewal. You technically have up to 90 days after the date you renew, but there could be gaps in coverage. All right, so then what happens when someone completes their renewal and they find out they're no longer eligible, which, is possible. So it looks, oh, wonderful. So Robert Wood Johnson Foundation and the Urban Institute came out with some reports or estimates from each state to kind of figure out how many people they expected might lose coverage after the pandemic. If you know Medicaid enrollment numbers and kind of their averages over time, we typically hover around 1.2 million people across the state, but during the pandemic, we gained up to 1.6 million. So really, on average, 400,000 more people than we typically see. And because of this, and because of the change in the unemployed rate and people accessing jobs and some employers paying higher wages, there were some estimates that were put together to figure out how many people might actually not be eligible for Medicaid moving forward. And they estimated us around 300 to 400,000 people that might lose their Medicaid benefits. And because they're no longer eligible, they could get access to other types of coverage, including employer-sponsored coverage, healthcare.gov, Medicare, as I mentioned earlier, and access to federally qualified health centers. This loss of coverage is what we in the business call special enrollments, or special circumstances that allow for a special enrollment period. So a time that you can access another form of insurance outside of an open enrollment period because there's been a change in your circumstances. And so typically loss of insurance. So if you lose a job and you lose your employer insurance, or you get divorced, and so you're no longer going to be on your spouse's insurance, or you are turning 26 and you were on your parents' insurance, but you can't be any longer. Those were all examples of loss of coverage special enrollment periods. And so with this transition of Medicaid and the Medicaid renewals, of course, losing Medicaid is also a special enrollment period. But because there's so many folks that are impacted by this, the federal government has implemented a longer special enrollment period for anyone who's lost Medicaid. And that will go through July 2024. So what that means is if someone lost Medicaid, let's say at the end of July of 2023, they could still qualify for a special enrollment period all the way through June of 2024. There are also other types of special enrollment periods. So if someone has a change in income or household size where their insurance wouldn't be available to them any longer because of that change, if someone moves out of a new county and the current insurance that they have is no longer in network to where they're currently living, if they had a change in immigration status, so like if someone newly becomes a lawful present resident, so holding a green card, or let's say they have a brand new work permit and social security card, those would be opportunities for them to access health insurance, even if they didn't have insurance before. Someone who is released from incarceration would also qualify for a special enrollment period. And then there's a couple that just happen automatically, depending on certain qualifications. So if someone is a tribal member, or someone who has low income below a certain level, And then, of course, someone who's lost BadgerCare through at least July 31st of 2024, they can qualify for a special enrollment period at any time, whereas these specific event ones last 60 days. And then there's a few that qualify if you're working directly with healthcare.gov or the health insurance marketplace, and you need, it was an unforeseen experience, and you need to work directly with a navigator or healthcare.gov to access these special enrollment periods. So that would be for financial hardship, a mistake made by a professional. So if someone uh, messed up on your application and it lost you the chance to sign up for coverage, that could qualify you for a special enrollment period, as well as someone who is a victim of a scam or a victim of domestic violence. And then there's also some unexpected life events like natural disasters and things like that that can also trigger a special enrollment period.
Can I ask a quick question here for you?
Sure.
I'm kind of curious. I've noticed for some people I know in my life, it's been the insurance companies that have taken it upon themselves to notify about the renewal period. And if people are in the Access app, they'll be getting notifications, hopefully, about the renewal period. Is there anything specific, and maybe you're going to get to this, that organizations that serve the public can do to help be aware of when these renewal periods are and notify their clients that they need to renew to avoid losing coverage?
Absolutely. And I'll get to a couple slides where we talk about some of the resources that are available.
Okay.
We have flyers and postcards and things like that that any organization can have on hand and can actually request directly from us,
Cool.
to have available to either their clients, to community members that come through, partners, and we can customize them too to include information about local enrollment assisters,
Cool.
so that it's near them. You know, they're talking to people that are familiar with their insurance market and the resources available and the options that are specific to that area of the state.
Right on. Great. Thank you. We also have a question here about, I think, the special enrollment periods. It says, what about a child who can be covered under a parent's insurance, but the parent drops them?
Yeah, and that's technically the parent's prerogative, right? Even though the law does say that a young adult can stay on their parent's insurance through their 26th birthday, it's not required that the parent does that. And so when that adult child or child in general loses coverage, that would qualify them for a special enrollment period. And the special enrollment period, it's important to know that it actually starts 60 days before you lose coverage and 60 days after you lose coverage. So what we like to recommend is that you actually reach out to us when you know the day you're losing coverage, because when you know that day, we can make sure that there's no lapse in coverage, and we can set you up so that by the time you lose coverage, your new insurance will start the day after.
Awesome. Thank you.
Thank you. That's a great question. All right, so I've talked about the special enrollment, new temporary special enrollment period regarding Medicaid. And so this is just emphasizing that exists, and it gives us a lot of flexibility. So no matter when someone may lose coverage and they didn't know about our program, we can still help them. And I think if that's the biggest takeaway from today is that Covering Wisconsin is here to help, and there's really no question, big or small. So even if the person doesn't really know what to ask, but they know they need health insurance, or they know they have insurance that might be ending, or any of that, if you get them to us, we'll figure it out. This is complicated stuff, even for folks who are highly educated. And so this is not something that, there's no question that is, there's no stupid questions, right? And so we want to make sure that we just get folks into our help, because then they don't fall through the cracks and go uninsured. And we just survived, are surviving an ongoing pandemic. So it's important to have access to healthcare because we don't know what'll come next, right? So now I'm just kind of going to walk through the different options that are available to folks. Medicare is one of the programs I mentioned. So this is for folks that are 65 and older or who have had a disability diagnosis for over 24 months and had been receiving Social Security benefits during that time. And if they lose Medicaid during this time, they do qualify for a special enrollment period to get signed up for Medicare Part A and B, as well as Part D. I'm not quizzing you on this. I don't expect you to know what Part A, Part B, and Part D are. Just know that you need all of them if you have Medicare. And there are folks that are very capable of helping with Medicare. So I had mentioned our partners who are agents and brokers. We also refer folks to the Medigap helpline, which is a great resource, usually tied to your local Aging and Disability Resource Center and the state Aging and Disability Office. And they can help kind of walk through with a person what their options are based on their current circumstances. And Medicare can be finicky, where it really is person to person what they may or may not qualify for. So I recommend utilizing that resource. At the same time, even though Covering Wisconsin doesn't specifically do Medicare enrollment, we're still a good referral because we will make sure that they get to the right place. So even if you're not sure, it's fine to send them to us. And then insurance through a job. We can't emphasize this enough because there are some barriers to qualifying for financial assistance in healthcare.gov if you qualify for affordable employer coverage. So if you send them to us, and that's great, we will check their employer coverage first because we need to see if it's considered affordable or not. And so typically people have a 30-day window to sign up for employer-sponsored coverage when they have a special circumstance. But because of it being Medicaid, this is actually under the HIPAA Act, which is health insurance private. Oh, I'm so bad at acronyms. Nope, I'm not going to do it to you guys. I'll get it all wrong. Maybe I'll put it in the chat a little later. But it's essentially the Privacy Act that when you go to the hospital, they have you sign to make sure that they're not sharing your information with people outside of who is serving you and providing your health care. And so under that law, they also included a special enrollment period for Medicaid. So this has been in existence actually for quite some time. So anytime someone loses Medicaid, their employer is required to give them a 60-day window to sign up for their employer plan. What we've learned is that a lot of employers don't know that. So we've actually been doing some education ourselves with employers to make sure that they're aware of this and that they are helping their folks who are Medicaid eligible transition to employer-sponsored coverage if they lose their Medicaid benefits. And in many cases, it might be a situation where the children are still eligible for Medicaid because they can be eligible at a higher income level, but the parents transition to the employer-sponsored coverage. Or in the case where the family plan is unaffordable, maybe it's just the employee that takes the employer plan, but then we're able to get the spouse in a healthcare.gov plan with financial assistance. And then we keep emphasizing, the opportunities that people have in times of transition, but we really do emphasize tips for avoiding scams because we know they're out there. We hear about them. We see consumers that come to us after a scam, which is always unfortunate. Enrollment assistance should be free. Before people are sharing information to anyone over the phone, there's some questions that you can ask, like, are you a licensed and certified enrollment assister, through the state of Wisconsin? Can I have your license number? Because we do all have one, and so we would have to give you that. And then are you showing me all of the insurance options available to me? Because if someone is, maybe specifically contracted with one company and they're only pointing you to one company, that might not be the best fit either. And then when people are looking on their own, sometimes people just Google health insurance, you know, um, you really have to be careful to make sure you're going on the right site. So healthcare.gov, gov being government, is the official site. And for the state and Medicaid, it's access.wi.gov. There is a healthcare.com, there is a healthcare.org, there is a healthcare.net, and all of them are misleading. Not necessarily all scams, but they all, a lot of people will put in some information in the website and then they get nonstop phone calls from people trying to sell them insurance across the country. And then in some cases, they end up on a site where people are trying to take advantage of their information, et cetera. So healthcare.gov, access.wi.gov. Remember the gov, it's government, it's official. And of course, if you experience a scam, this is the phone number that you can reach the Wisconsin Department of Agriculture, Trade, and Consumer Protection. All right, so now we're getting into the tools. So Covering Wisconsin is a great resource, not just for referrals for navigators, but we have a lot of resources on our website available to the community. One being our brand new Covering Wisconsin Unwinding webpage, where people can learn kind of what the process is and what information they need to find, and some documents on how to go through the renewal process. And that's coveringwi.org/free help. We also have a library of materials that we have created over the years and have maintained and updated that talk about using your health insurance. So we have specific resources for healthcare.gov. We have specific resources for insurance in general. We have resources for Medicaid specifically, and then just community programs. And I recommend that you take a look. What we usually share are resources that can be used with someone. So when you're helping someone, it's a great tool to reference, especially if you're trying to explain something a little more complicated. And then all of our materials are in English and Spanish, and then other languages upon request. And we have a few of our resources that are already available in Hmong. But as I mentioned, we are available to create any of the tools if there's another language that you would like us to have it in. And then these are a few of the updated resources that I mentioned specifically about the renewal process for Medicaid. This one is how to download the My Access app and find your renewal month. And then this one is the actual renewal process on access.wi.gov. So it's a great step-by-step for someone who wants to try to do it on their own, or maybe you're helping someone do it and this is new to you as well. So you can go through the process. And then of course, in each of our documents, we show where you could also then ask for enrollment assistance, because you don't have to do this by yourself. We also have a couple other resources that we've developed over time, one being this public charge screening tool. And this was actually in collaboration. Covering Wisconsin is a member, a founding member of the Wisconsin Collaboration on Immigrants and Public Benefits. This group was formed during the Trump administration, when there was a change in public charge policy. It used to be where there were only two programs that impacted someone's eligibility when they were trying to get their green card or a brand new visa. And during the Trump administration, they tried to add a lot of different other public programs, and not all of them stuck. But the damage was done. People were scared to apply for programs that they were eligible for or that their family members were eligible for. When the Biden administration came into control, then they changed it back to that old policy, but we're still seeing the negative ramifications of people being scared to sign up for programs that their family qualify for because of that change in policy. There was a recent study that said 1 in 4 adults, immigrant adults that that were eligible for coverage did not actually enroll in any safety net programs because of their concerns regarding their immigration status. We also have some eligibility tools that people can use, both on Covering Wisconsin's website. We have a 2-question tool that helps you find out what you might qualify for before you get into anything. And it's more just so that you feel comfortable before you reach out to us, even though you could just reach out to us. But there's also a resource on access.wi.gov to find out if you would be eligible for Medicaid. But for Medicaid in particular, you can apply at any time, and there's no issue with someone applying. The only person who, or well, the only entity that can determine if you're eligible for Medicaid is the state and the state Medicaid offices. So even me as a navigator, I can look at your current situation and I could see, based on eligibility rules, what you are likely eligible for, but I would still submit a Medicaid application if that person wanted me to, because they have every right to apply. And like I said, the only entity that can determine eligibility is the state. We have plenty of outreach materials, so you don't have to recreate the wheel. We test all of these resources with our partners and with community members, and we try to update the look and feel of them each couple of months, particularly with this whole unwinding transition. And then open enrollment is around the corner for healthcare.gov. Open enrollment is November 1st through January 15th, where people who have Medicaid, marketplace coverage through healthcare.gov can renew their benefits, including their tax credit, as well as checking to see if there's a more affordable plan for them, or a plan that just works better for their health needs. And we have all of those resources available to our partners on our website through coveringwi.org/toolkit. And if you find a postcard or a flyer or something that you like and you want a lot of, you can actually ask us and we can print and send you a certain number of those postcards. We can also modify it so that the phone number is the closest enrollment assister near you. So like, for example, if you're in the Appleton area, we would include our partners at Partnership Community Health Centers, because they are our subcontracted navigators in that area. Oh, and there's a little commercial. Can you hear this? No, okay. I didn't know they actually played it. There's a little commercial. We have things like commercials and GIFs and social media posts that you all can use as well, that that are actually very, very well produced. We have a really great team. It's a very small but mighty team that puts all these resources together. So if you have a chance, when I give Landon the slides to watch our little commercial, there's also, when you go through and peruse the toolkit, you'll see some of those GIFs and such. We have some links, so you can follow us or the Commissioner of Insurance, the Department of Health Services, and healthcare.gov to reshare and spread the word around open enrollment, Medicaid renewals, et cetera. And if you want to get more involved, I'll highlight some of the work I do, which is bringing our partners together to make sure that we're all on the same page around policy, strategizing around outreach and who's doing what in the community, and then bringing crucial feedback from what's happening in our communities back to the state so that the state can implement it in how we're implementing this transition. And so these enrollment networks started way back during the first year of the open enrollment period for the health insurance marketplace, but many of them sunsetted, and now they have been recreated in order to meet this moment that we're in, to make sure that folks do not fall through the cracks as they transition from Medicaid to another type of coverage, or they maintain their Medicaid benefits. And so as you see, there's regions, but we also have 2 brand new enrollment networks that are affinity enrollment networks. So we have a Latine enrollment network and a Hmong enrollment network. The Hmong enrollment network is having their kickoff meeting on the 27th of this month. And they're our newest and 10th enrollment network. And these lovely people are the enrollment network leads across the state. And so you can either click this link on top and complete a quick survey if you want to join, and you can select as many as you'd like to join. Or you could reach out to these folks directly. And as you see, I am the enrollment network lead for the Southeast and Southwest region. Tina, who you would have seen today, is the enrollment network lead for the Central region. And if you want to make an appointment for someone, whether it's directly with one of our navigators or one of our partners across the state, you can go to coveringwi.org/enroll. And by putting in a zip code, a phone number, and their first and last name, someone can make and book an appointment. They'll get a text message saying when that appointment will be. They'll also get a reminder text 24 hours before the appointment. And then one of our navigators, whoever they booked with, will get an email saying when and where that appointment will be. And they usually will reach out if there's an email associated with the reservation. We can email them some information. Otherwise, we'll give them a call and let them know if there's any logistical things that they need to be prepared for. Of course, people can also call us directly, and I have both our local number as well as our Milwaukee number, as well as our statewide number. And then anyone can call 211 and also get connected to us. So if someone calls 211 or texts 211, which I think is like 898-211, they can put in their zip code and then ask for health insurance help. And more times than not, they will get them routed to us. And then we have a new resource this year, which is our Covering Wisconsin chat feature. So when you're on our website, you'll notice that a box comes up that asks some questions, and it allows you to ask for free expert help or ask questions, and that will get you to a live navigator who will help walk through any questions that that person may have. The live feature is available from 9 to 4, Monday through Friday. And then there is a kind of a callback feature for any time outside of that window that will make sure that we get connected to that person by the next business day. And I left Tina's information up here, but when I introduced myself, my email was up there. So you have access to both of us. So I'm happy to take any
Yes.
questions or.
Thank you so much. Yeah, I was just getting my screen back up here, but one thing that we didn't, I mean, there's a lot packed in there. So thank you so much for presenting on all of that. It's kind of hard to wrap my head around all the various ways that we can try to ensure that people don't lose their coverage. One thing we didn't really talk about, because I don't think it's on the Covering Wisconsin side of things, but is the major disruption that can occur in a person's life when they lose coverage, especially when trying to find their employment goals, which is, what a lot of us on the call do to help serve people. So I guess I don't have a question so much as want to reemphasize when you receive the slides of this, to revisit all of those links for the toolkit and the resources that you can use. Is there, like, Carolyn, if they follow on social media, is that a good way to just kind of share resources that are being put out by Covering Wisconsin? It seems like it might be a fast, easy way to start getting that out there.
Yes, so through our Facebook and Twitter, we regularly update new posts and make sure people know key deadlines that are coming up. So
Great.
that is a quick way to stay connected with us. We also have a listserv. So if there's anyone that wants to be on our Covering Wisconsin listserv, we don't we don't in
I'm not sure if that's my computer or hers. Okay, it seems like her computer has frozen, which is unfortunate. Um, okay, well, we'll give it a second, see if she unfreezes. I'll go through some of the ending stuff here, which is just to reemphasize that I think we have to be part of the network of reminding people about the renewal coverage, because it's so easy for people to ignore phone calls. It's so easy for people to ignore emails. I think the constant reminder is something that everybody needs. So hopefully these resources will provide good tools for you to be able to speak to the people that you serve. So but I want to remind you that we'll be providing all of this information today in a PDF at the end of the week, so that you can be able to click on all the links and have them for reference. Excuse me. I mentioned before that we have as far as these sessions go, we have a little feedback form. It takes no more than 2 minutes to fill out, where you can just let us know how we did. And if you are so inclined, you can also suggest topics for the future. I know that housing is one of our most popularly requested, and we're going to be attempting to tackle that next month. So if something is specifically affecting the people you serve, let us know at fsc-corp.org/LL feedback. LL stands for Lunch and Learn, which is what we are currently doing. We'd really appreciate you doing that, and we always look at the feedback and take it very seriously. What else we got here? Follow us on social media at Forward Service. You can search on any of the big networks, big platforms. We're always putting out stuff, and we will also share covering Wisconsin's materials. So you can start with us, you can start with them, whatever makes sense for you. We hope it's just a resource for you to be able to give new materials to the people that follow you on yours. It looks like Carolyn is back. Since we have 3 minutes, I will let her jump back in.
Yeah, I so apologize. My internet just went out.
No worries.
But what I did want to mention is as you're helping folks, find employment, I know one barrier too with employment is, will that new job that might give them a start in a career have benefits? Like I think of small businesses and such that have a hard time offering that because of the cost it is for their employees. That is what healthcare.gov really was made for, was so that people who might not have access to employer benefits, traditional benefits, can still take that job or maybe start their own business. I'm thinking of like entrepreneurs and such, and still have health insurance. So they can go to healthcare.gov, they can usually qualify for some financial assistance to lower the cost, and then they can take that new job as well as still have health insurance to make sure that they're meeting their healthcare needs. And then in many cases, we'll see a lot of families that are eligible, maybe, as I mentioned, are eligible for employer coverage, but the family plan is like super expensive. That's a great opportunity too for maybe the employee to just have the employee plan, but then their family members could go to healthcare.gov and qualify for that financial assistance. Or in some cases, maybe the spouse qualifies for marketplace coverage through healthcare.gov, but then the children are still actually Medicaid eligible. And how complicated is that we all have different plans in our household? But the reality is that's how the US insurance system and healthcare system functions. And we have people that can help kind of literally navigate through that, because it's not easy, but people shouldn't go without healthcare.
Yeah, absolutely. I think that's a great note to go out on. And I always want to thank you for being here and speaking to us again on such short notice. I think this is a fantastic information for everyone to know. And hopefully they'll be able to reach out to you or to Tina with any questions. So I really encourage people to dig through these slides once we share them on Friday and connect with Covering Wisconsin. I think it's a great resource. So thank you so much for being here. Thank you all so much for being here. And we hope to see you next month.
Sounds great. Thanks,
All right.
Landon.
Thanks, everyone.